Hello, it's Facebook Live. It is Tuesday at 2:30, and I'm afraid you've just got me this week. Naomi's on leave, so we cover each other's shifts. But yeah, so just waiting to see if I see anybody coming up. Hopefully some names will start coming up. I'm just going to see if it's coming on my computer as well. Make sure we're going out there. Yeah, lovely. I can see some names coming up now. That's wonderful. It's wonderful. It's so reassuring because you sit here and you're just talking to this camera and it's a bit like, well, you're talking to ether. You think there's nobody out there, but I can see all these names coming up now. Welcome, welcome. It's Alex from Infant Feeding. This is a Facebook about infant feeding. So here to talk about anything to do with feeding, early days, even late days, doesn't matter how old your baby is, talk about anything to do with feeding, however you're feeding, because we're the infant feeding team, we're not just one way. So, yeah, I can see those names coming up. Lovely to see all those people joining us. And Charlotte's the first one up. Welcome, Charlotte, saying hi. So I'm to ask if I'm having a brilliant day. Now I'm looking to see if I can get it up on my computer because it's much easier to read your questions on the computer. Let's see if it starts coming up on there. But as I said, I'm on my own today. Naomi's on leave. She's got a week off. She'll no doubt be cycling around. She's a keen cyclist, is our Naomi. She'll be out there enjoying the sunshine that we've got today. It's a nice bright day, isn't it? But let's make sure we can see all of this. Let's get these comments coming up. Wonderful. We've just been in clinic this morning, myself and Elisa, so many of you may have already met Elisa through clinic, and she's done a couple of these as well, these sessions. And we always ask when we're in clinic, what do you think we should talk about today? Because last week we talked about a little bit about medications, and we've talked about all sorts of stomach sizes and things like that. We've talked about formula in the past, and the fact that you only need to buy the first stage formula. You don't need to go and buy anything else. All the others are marketing ploys. And actually one of the mums said to me, talk about tongue tie. Now I know that's a really hot topic, and you know, it's one of those things that you hear about. So many people, if they're having feeding problems, get told, well, maybe it's a tongue tie. And just to say that, you know, we only do anything about a tongue tie if it's impacting on feeding. So if feeding is going well, or we can make feeding go well with good positioning attachment, even if we can see something, we are not going to rush to do anything, because the process of dealing with a tongue tie is to have the frenulum cut, so that little piece of skin that's underneath the baby's tongue, they literally cut it with a pair of scissors. So we only do it if we think we absolutely have to refer. We ourselves don't do it, although some of our team are trained, but actually it's, you know, we refer within our team to the ENT, ear, nose and throats team in the hospital, and they run tongue tie clinics and cut the frenulotomies. It's called a frenulotomy, it's a frenulum, that piece of skin. But as I say, what we do is we will work with positioning attachment. So if you've been in touch with someone who thinks your baby might have a tongue tie and suggests that you come and see us, the first thing we will do is work on positioning attachment, because positioning and attachment can make such a difference to what's happening if you can get it really as good as you can get it. And a millimetre here or there can make such a difference as to whether you're comfortable or not, or whether your baby's getting enough milk or not. So if we see you and you're coming because you think you might have a tongue tie, we will do an oral assessment, but we will also watch feeding. We will watch what you're doing. And if your baby is able to remove milk effectively with good positioning and attachment, then there's no indication to have a frenulotomy. The reasons that we might refer you to have that tongue tie cut would be if your baby's completely and utterly not managing to attach and we think it's the tongue tie, if your baby is not gaining weight and not feeding effectively, or if you, even if they're able to feed and gain weight, you are in constant pain and we've ruled out that it is not positioning and attachment, and that we think that having a frenulotomy, a tongue tie cut, might make a difference, that's when we would consider doing it. So we don't do it for any other reason other than feeding. We don't do it for speech, and we don't do it for, you know, eating later in life when they get to 6 months, because we don't know it's going to be a problem. You know, we know there are lots and lots of people out there who have got tongue ties. Their tongue is maybe slightly restricted compared to someone else, but actually it's never had an impact on them. So what we would say, well, why would you do anything? So following this comment made by the mum in clinic, and she said, please talk about tongue ties, that's why I'm saying this, to say we will refer babies if we believe the tongue tie is causing a problem affecting feeding. If it's causing a problem in that mother is sore, if the baby's not attaching, the baby's not gaining, But if we can get feeding to go well without any of that, then there's not an indication to have it cut. So just so you know, if you do get sent to us, that's what will be happening. We will do an oral assessment and we will look at positioning and attachment. So I'm just keen to see, we've got a couple of messages coming up and just see what they've got on here. Gosh, Alicia is going to be 11 months, apparently, Charlotte's saying. Dorothea has said, should storing colostrum before birth, this affects birth colostrum? No, it doesn't. So if Dorothea, if you want to collect your colostrum prior to your baby being born, it doesn't have an impact on your milk supply afterwards. In fact, to the point where we would say, if you've got stored colostrum and you're struggling to get to feed your baby when your baby is born, you must be expressing as well, and not just giving the colostrum you've already got, because anything you do prior to your baby being born does not have an impact on your milk supply going forward. So having colostrum you may have collected before your baby is born is a bonus. It's wonderful. It's like an insurance policy as such, but it is not going to impact on your supply going forward. And if you then go and give all the colostrum you've collected, if you collected a lot, and don't feed your baby or don't hand express, then you're going to have a problem with your supply, even though you had lots beforehand. So please don't feel that just because you've got it, you have to give it. You could actually just take it back home again, and that doesn't matter. And if you have got lots of colostrum that you haven't used, you could consider donating it to our milk bank, and they're always delighted with colostrum, because that's very rare that they get colostrum. So it's lovely for them to be able to have donations of colostrum that hasn't been used, because the mum has got a great supply. And then they can use that colostrum for their babies on the neonatal unit, those premature babies, those very small babies, those unwell babies that actually would really benefit from colostrum as opposed to mature milk. Obviously it's wonderful to get mature milk, but colostrum is full of chock-a-block, full of all sorts of things that it's not quite the same as that mature milk that you get. So Dorota, by all means, do collect it, but it's not going to affect what happens afterwards. You can give it. It's used particularly with mothers who have diabetes. So anybody who has diabetes, we would highly recommend that you are expressing before you have your baby. Try and bring a little bit in with you. That's because a baby who is born to a mother with diabetes is going to have their blood sugars checked lots. So because the mother's blood sugars may have not been as stable as they could have been, a baby is also checked when they're born. And if the blood sugar drops, which very often happens, the baby needs more food. And the best thing to give a baby to get their blood sugars back up is colostrum. It's absolutely spot on. I always describe it as golden syrup. I always think it looks like golden syrup because it's thick and gloopy and sticky, but it's also chock-a-block full of all the things a newborn baby needs in a way that other milks aren't quite so much. So colostrum will really bring blood sugars back up again if you are a mother with a baby with diabetes, if you have diabetes and your baby's being checked. It's absolutely the best. So the question's not coming flying in, so think about what you might want to ask. So think, just to go back to talking about tongue ties for the moment. So thinking about the tongue tie, it comes, if you think about it, we would talk about someone being tongue tied. In fact, they can't move their tongue so much. So when you look at a tongue tie, what you're looking at is, if you can see it, it's going to be an anterior tongue tie. So if you think about the length of the tongue, it's coming right to the end of the tongue. That's what's called an anterior tongue tie. So it's right at the front. And sometimes you have what's called a posterior tongue tie. So that would be much further back. Whether it's anterior or posterior, even if you can see something, doesn't mean it's going to impact on feeding. So when we do our oral assessments, what we're not doing is just looking. We're doing way more than looking. If you come and you see us and we do an oral assessment, you'll find that we put the baby either on a changing mat, or in my case, I put them on my lap. I'm very small. I can't really reach the changing mat easily, so I find it much easier to put a baby on my lap. And I have the mother next to me so she can see exactly what I can see. And I get that baby and I hold them and I look at their face and see, have they got a nice symmetrical mouth? And then I get them to see if they'll open their mouth, and when they open their mouth, I get to see what they do with their tongue. And we're looking at tongue mobility. Can this baby move their tongue well? Can they move it up? Can they bring it out? Can they go side to side? And then we feel the suck, and we put our fingers in the mouth, get the baby to suck our fingers, and we feel and see, what does the mouth feel like? So if you think about a baby's mouth, and you can feel it in your own mouth, you've got your hard palate, and then your soft palate, and then you've got your tongue. And when you put a finger in the mouth, you can feel the hard palate and the soft palate. Now, some palates are much higher, so your finger might disappear up here, and some palates are much flatter, so your finger will go back. So sometimes we find that a baby with high palate may have a tongue tie too, or you may get the odd baby with just a high palate and no tongue tie. So those two things, may sort of work against each other. So what we're looking is, what is the palate like? And then what's the tongue movement like? What's the suck like? Can the baby hang on to the breast? And then we have a look under the tongue. So it isn't just looking at what we can see, it's feeling how the baby feeds, how they suck, looking inside their mouth, being very aware of the whole situation before we make a decision about whether this tongue tie is impacting on a baby, if there is one there. As I say, there are lots and lots of people out there walking around with tongue ties who don't even know they have one, and they can't tell you how often we've met mothers and we've said, is there any family history of tongue ties? Because sometimes it runs in families, and they'll say, well, I don't know, and we get them to lift their tongue in the days when we were allowed to and we could see each other's faces, and you can see a tongue tie, and yet they've never had a problem with speech or eating or even as a baby feeding. So just because there's something there doesn't mean it's going to be a problem. Right, I can see questions have been flooding in, so I'm going to crack on with those and let's have a look and see what we've got. So I've got 8 comments, make sure I get them all up. So you go right down to the bottom. Oh, I'm hoping I've not missed any because it's not showing all of them again. Why does it do that to me? Bear with me, I'm just trying to get the comments up because I can see it's missing some of them. They're not all there. Right, let's just do it on here for a second. They flew in. Right, I've answered Dorota. Charlotte said that her daughter's now nearly 11 months old. Charlotte's asking whether her baby should be on normal full-fat milk as well as formula at this stage, and she's only 11 months. So Charlotte, hang on a little bit longer. It's usually over a year. So wait till the full year and then start offering Alicia milk. That would be fun. Have a chat with your health visitor about it as well. Hope that helps. Sarah, other than skin to skin, is there anything else you can do to encourage a healthy milk supply? Hand expressing would be the other way to try, Sarah. You could be doing that. So we know that skin to skin does make a huge difference. I had a mum in clinic, I'm not going to break any confidences because you won't know who she is, who talked about her first experience when the baby hadn't had so much skin to skin, and her second experience, and she said that she had a lot more skin to skin this time, and she was very aware that her milk supply was better. We do know that delayed skin to skin and no skin to skin can have an impact on your supply, so skin to skin is important. The other thing that really makes a big difference to a milk supply, if there's any concerns with the baby removing milk effectively, is going to be hand expressing. So getting that baby on, feeding them responsibly whenever they want to be fed. If they're doing that, they'll drive your supply. If there's any concerns, if you've got a baby that's jaundiced or drowsy or not removing milk effectively, back it up with hand expressing. I think we've said it on this session so many times. You've got options if you've got a milk supply. We can get babies to feed, we can encourage them to feed when they're older, after the first week, second week and beyond. But if you haven't got a milk supply, it's going to be really difficult. So skin to skin is fantastic. Early skin to skin makes an enormous difference, and getting on, encouraging your supply, kickstarting it, I always call it, kickstarting your supply with loads of hand expressing if your baby's not doing the job for you. So keep going with that, Sarah. And the midwives will help with all of this. Ruth has said, can you be on monitoring while in the birth pool? I'm going to ask you, Ruth, to forward that one on to Wendy Randall, because this is the infant feeding session, and she will be the one who can answer that. I haven't been on Delivery Suite for a while, and so she'll be much more up to date. I think she did a session last Monday, so I think it might be a week Monday till her next session. Or have a chat with your own midwife about that, and she'll be able to let you know. So Ruth, I'm going to forward you on to your midwives or Wendy Randall's midwifery sessions, Facebook sessions on a Monday. Hope she'll definitely be able to help you with that one. Jessica said, thanks for the advice last week about transition. It's difficult doing it on here. away from the nipple shields. I've had some success this week with her 5-week-old baby, wonderful, but my little boy latches on and off multiple times at the start of a feed. Excuse my fingers, I'm just trying to get the rest of the picture up there. Multiple times to start a feed. Does this mean the latch is not good? I also noticed the milk runs out of me without any compression or sucking once the feed has started. So I wonder if he struggles with too much milk at the start. Yes, if things settle down, it might well be that actually what's happening is that he's not coping with the letdown at the beginning, Jessica. Again, I go back to what we always say, look at your positioning attachment, remember what you're aiming for. Just looking for the picture, remember you're always aiming for this. Is he going on with his chin right down here? Is this baby's going to come on straight? No, the mother is not going to do this. The mother is going to bring the baby on like that. Make sure your baby is on as well as they can be, because they're much more able to milk the breast effectively if they've gone on really well. But that's fantastic progress. So, that's really wonderful. I'm so pleased for you, Jessica, that you've managed to get your baby on without the shield. Just keep it a positive experience. If he gets upset, do something else. Don't let him be upset at the breast. Keep it positive at all times, and then things will just get better and better and better. So yes, quite possibly he's not quite struggling. He's struggling at the moment with that letdown, which when you were wearing a shield was less obvious. So it's much more obvious when it's much more straight into his mouth if he hasn't got a shield. If he's got a shield on, it's going to stop that flow in a way, so he won't have been so aware of it, and now he's got to learn how to deal with it. So see how you get on with that, and just try again positioning attachment. But I just say congratulations, Jessica, that's fantastic that you've managed to do it. Ruth's come back and said sorry. No problem, Ruth, it happens all the time, don't worry. I'm just sorry that that I can't help you on that one. I won't give you the most up-to-date information. Just trying to work out why my laptop is not giving me these questions. Sometimes it does and sometimes it doesn't. So I've got some of them on here and some of them not. So I'm going to carry on down. So Jessica, thank you for that question, and all the best with him. It's not an issue. At the bottom you said, is it a problem for him? No, it's not a problem for him. He will cope. He might come off because it's coming a bit forcefully. An upright feeding position might really help as well. So thinking about, I know we've done it on here before, these, having your baby in an upright position may help, because gravity will help him on that one, rather than being in this position. So maybe try an upright position and see how he copes. And that's much more feasible when you're not using a shield and upright position. Or in fact, you can use a shield anyway. But just try that. It may help him control the flow a little bit better. I hope that helps with that one. So that was Jessica. Charlotte, who said, Charlotte's one of our frequent visitors. You'd get flying points from us if we did them. Is it okay to feed my Alicia full fat milk as well as formula? I mentioned that before, and just wait till she's a year, please, Charlotte. So formula right up to the first year, and as we talked about on these sessions before, it's always first stage formula. You do not need to move on to anything else. I know the adverts all say, when your baby's ready to move on, your baby does not need to move on. Your baby can stay on first stage formula from birth to a year. There is no need to have anything else. You do not need to buy follow-on milk, colic milk, hungry baby milk, sleep tight milk, or any of the other marketing ploys there are out there. They're not necessary. So you could just stay, and the recommendation is you stay on first stage formula if you're using formula from birth, if you're using it at birth, right up to a year of age. You never need to go on to anything else. They are marketing ploys. So your baby gets all the nutrition they need from first stage formula right up to a year of age. So there you go, Charlotte. Hang on to the formula. Keep going just for the moment, and then when she's a year, you can move on to that full fat milk. Fiona's come on and has said, is it possible for a baby to feed too much? My daughter is 4 months old, exclusively breastfed. How I don't know if she's feeding too much or putting on too much weight. So one of the things that we always say about breastfed babies, Fiona, is that they cannot be fed too much. You cannot overfeed a breastfed baby. You can overfeed with a bottle for fairly obvious reasons, but with a breastfeed, your baby is totally and utterly in control. And we often find that breastfed babies can be quite chunky. You often get them, they've got these lovely elastic bands around their wrists wrists. Not all babies, but some. And actually once they start to move, they begin to lose that. And it's known that by the time they get to age 5, they've seen on research that the babies that have been breastfed have better BMIs than babies who have not. So, it is definitely protective against obesity in later life and in childhood. So breastfeeding is absolutely perfect for your baby. You will not feed your baby too often. It's not possible, because remember, feeding is for so much more than just food. Babies feed for comfort. They want to check in you're there. They might be feeling cold. They might be feeling a bit lonely. There are lots and lots of reasons why babies breastfeed, and it's not just the food side of it. And with regard to weight, we don't worry. We don't worry about a baby if she's breastfed at all, so just keep going. And remember, we've talked about it on these sessions before, every time you interact with your baby, whether it's a breastfeed, whether it's a cuddle, stroke, or a chat, or a sing, you are bathing your baby's brain in oxytocin, because that interaction releases oxytocin in your baby, and that goes around their brain, and it's the fertilizer for your brain. So we know that the lovely organisation called Grow Brain that do this leaflet called Bonding and Brain Development, they've written about it. If you want to have a look at it, it's an organisation called Grow Brain, so GRO Brain, and have a look at their resources. And it talks about how you cuddling and loving and talking to your baby is growing their brains, making them happy babies, and then happy children and happy adults. It talks about bonding and tuning into your baby, so being aware of how your baby's feeling. It talks about comforting a distressed baby, baby talk, so talking to your baby, and building your baby's brain. So that's quite a nice leaflet. If you're online, you can get it. But that all fits with a baby being fed a lot, and that's your baby checking in. It's not just food. So don't worry about overfeeding. It's not possible, and your baby cannot gain too much weight as a breastfed baby, even if they're little chunky monkeys. It's absolutely fine. It will sort itself out. So I hope that's reassuring for you, Fiona. Laura has said, hi, on tongue ties, my 3-week-old had a posterior tongue tie division on Tuesday. He's been predictably unsettled, absolutely, since, although does seem to be recovering now. Is there anything feeding-wise? I'm just trying to open the rest of your question. We should be focusing on with feeding to help his recovery prior to working on re-establishing feeding. Nothing specific, to be honest. I know it depends on who you see, whichever the practitioner is who has been, has done it. Some practitioners will tell you to do some exercises. Feeding is the best exercise though, because as Naomi will always tell you, it's physio for the tongue. It really gets that tongue moving. Those, as you said, it's predictable once a tongue tie is cut that a baby is unsettled for 24, 48 hours. And sometimes mums will report that the first feed after the cut was done, the baby fed absolutely beautifully, no problem, and then it goes backwards for a bit, and that's really common. We hear that a lot. And it can take a couple of weeks before mothers really start to say, actually, you know what, I can see there's a difference now, it feels good. I have had one mum who came to clinic who had a tongue tie cut. She said it was instantly better and it stayed better, but that's not what we normally hear. We normally hear that 48 hours of a very unsettled, unhappy baby, even babies who sometimes will put their tongue up and won't bring it down, which makes it extremely difficult to feed. Really unsettled babies, then it starts to get a bit better, but not really noticeably better for quite a while. So I think just keep going with the feeding. Offer the breast, keep the breast a positive place, and try different positions if you're struggling with one. So if you're in cross cradle and the baby's getting upset, maybe try upright or underarm or lying down. Just mixing it up makes such a difference for the baby, and you just that will often work. If they won't go in one position, they often will in another. So I think you're doing all you can at the moment, and it is just time, Laura, so just keep going and hopefully things will start to improve shortly. I feel like I say that all the time, I'm so sorry, but remember, feeding is going to be great physio for that tongue. Nadine has said, I really struggled to breastfeed my firstborn, a mixture between a bad latch, high palate and low supply. I'm 30 weeks pregnant and wanting to try to breastfeed again, but I'm worried about having a low supply again. So that's where we'd be saying belt, we talk about belt and braces, so covering all bases, making sure that once that baby is here, so uninterrupted skin-to-skin contact. So I'm just grabbing a leaflet, the one that's behind me. Thinking about how important that skin-to-skin is, thinking about those 9 stages the baby goes through, getting that baby on. So if you had delayed skin-to-skin or interrupted skin-to-skin with your first baby, that's the first thing you're going to change. You're going to make sure you have uninterrupted skin-to-skin contact until your baby has fed. So keep your baby with you, no cuddles with anyone else, not on the weigh scales, stays on you for OBS and vitamin K and doesn't go anywhere else. Keep your baby close, that will make a really big difference. Back it up with expressing. So if you had a problem with your milk supply last time, back it up with expressing. Nadine, there are some reasons why some women might struggle more with their milk supply. So it may be worth giving us a quick call on the telephone and we'll talk through your medical history and just see if there's any reason why you might have had a problem last time, and we can talk it through. You've got a few weeks to go, which is good, and so we could be talking about maybe doing a bit of expressing before this baby comes, starting at 37 weeks, making sure that it's in your birth plan, that you're going to have uninterrupted skin-to-skin contact when this baby comes, not going to be moved off you until that baby's fed, and carrying on with as much skin-to-skin as you can after that, because that will make a difference too, and being proactive if your baby's not feeding particularly well, or even if your baby is feeding well, being hands-on, get expressing, really push your milk supply this time. But Nadine, can I suggest you give us a call, and our number comes up after this, I think, and then just give us a call and we can quickly talk through and make sure there isn't any particular reason why you might have had a problem last time. We just know that a slow start can make a really big difference, but there are a few underlying conditions that do put some women on the back foot. So Nadine, give us a shout please, and then we'll have a chat through with you, if that's all right. Just carrying on. Immy, hello Immy, and how is Leo? She's asking if I'm well. Leo keeps going to the breast. I'm struggling because it's all under here. 2 sucks, then comes off, goes back, 2 sucks, then off. Doesn't seem to be wanting much. Oh, he's got to that age, he's quite old now, isn't he? I wonder if you're in that position where you need to be doing feeding in the dark almost, where is he rubbernecking, as we call it, where he's looking, when they go on the breast and then they hear a noise and they're like, whoop, what's going on? I want to know that. And then back on and then, oh, I can hear a noise, and they hear the television or someone walking in the room. So, it may be part of that. Is he getting feeds? Is it during the day when he wants to be interactive much more? Maybe he needs a little bit more when he's sleepy, so catch him as he's waking up. He might feed slightly better then. If he's during his sleeps in the day, catch him at the end there. Offering him feeds in the evening, maybe giving him a dream feed, just as as you're climbing into your bed. If he hasn't had a feed for a little bit, offer him another one then. Just get his intake up. Watch his nappies, make sure that he's getting enough in a 24-hour period. It just might be because he's getting that little bit older. And he's already on solid foods as well though, isn't he? Because we talked about that the other day. So, you could try a cup as the other thing you could be trying, is having a cup around for him with a bit of your express breast milk in, and see if he'll take it that way as well. But I bet the night feeds aren't too bad. I bet he doesn't mind those ones, because that's usually the ones they're really happy to continue, and sometimes just to get a bit interested in the world around them as they get older. If it persists in me, get in touch. You email me again and we can carry on and think of other things. And talk to your health visitor as well, because she may have some good suggestions as well. But I bet he's making up for it at night though. All the best to him and you. Moving on to Andrea. She's exclusively breastfeeding her 3-week-old baby boy. I know all the theory, but I'm struggling to put this into practice. I know it's really hard, and it's all very well we talk about it, but it's so difficult. It's a learned skill. You can't teach dancing by standing in front of somebody. You have to do it with them. You can't teach skiing without putting a set of skis on and getting off, go on the slopes. So I do get it. It's a learned skill. We need to do it to learn it. What can I do to make him open his mouth widely and not be painful when he's latching? His upper lip is where it should be, but his lower lip is near my nipple and it hurts. Yeah, it will do. So thinking about making him reach for the breast. So we talk about thinking about, in a way, it's a bit like teasing. So if you think about having him here, but not so close that he can go on. I'm trying to do it so you can see it. So not so close that he's there. And you just brush his upper lip against the nipple, but don't let him get so close he can go on. He's going to go, ah, for it, and then you bring him on, like that. So it's making sure that he's got to reach for it. Because if it's just there, he's just going to go on and that's no problem. He doesn't need to open his mouth. But if you start, and it's this whole thing about nose to nipple, start nose to nipple, he's going to go, I want to feed, but he's got to open his mouth then. So he's going to go, and he has to open his mouth wide. So I think it is that nose to nipple, don't have him too close so he can just nibble on. So he's there, and then he goes there and on. So really work on that nose to nipple, so then he tips his head back. So it's that being able to tip his head back. If he doesn't need to tip his head back, because it's here, he doesn't need to open his mouth. But if it's there, he has to. So I think it's making sure he has to reach for the breast. He has to tip his head back, open his mouth wide to go on. So, and if you look at that picture that I'm always showing you, if I can find it, that one. So if you look at that baby, if that baby had been higher up, it would the mouth would have been there. But because this baby's right down here, the mouth is there. And so the baby's got to tip its head back. And then when they tip their head back, they open their mouth much wider. See how you get on with that. And, you know, if need be, we can do an attend anywhere and watch you doing that, trying to get him on. So, Andrea, I hope that gets better. And well done for doing 3 weeks of exclusive breastfeeding. He's a very lucky baby, especially because it's been painful. And, you know, we don't underestimate how awful it is when it's painful. It's really hard. But keep going, because it will get better. All these mummies on here, like Imi, who's just been put a message up, you know, Imi didn't find it all simple in the beginning, and she was coming in the middle of lockdown to see us here, so I'm sure she doesn't mind me saying this, but, you know, it is normal to need help, and unfortunately, you know, we resorted to having to do help like this, so we'll do as much as we can. If we need to watch you on Attend Anywhere, or if you need to come into clinic, although we're quite busy at the moment, it might be a while off, then that would be the way to go. So just remember how wonderfully you've done. You've exclusively breastfed a baby for 3 weeks already, and it will get better. So I'm going to carry on. Dileka said, hi, do you have any advice while I am breastfeeding my boy who has reflux? Right, I'm going to start again with the whole thing about making sure the position attachment is as good as it can be, because we always start there, because we know it has such an impact on all aspects of feeding. You know, is it reflux? Is he bringing absolutely everything up? Is it just a little bit? Is it spit up? So it's quite normal for babies to bring a bit up. If you think about the sphincter valve above the top of their tummy, here, it's like that valve, it's quite immature. It doesn't do a great job in babies, just keep all the milk down. Sometimes babies, because they're not going on as well as they can do, they're taking more than they need, because they're taking more of that waterier beginning part of the feed, not getting through to the fattier part of the feed, and therefore they bring up a bit more. So that's why I'm mentioning about positioning and attachment. If it really is reflux and it's causing your baby a lot of upset, then we would normally talk about going to see your GP and having a chat with your GP, and they may give you some medication to help with that, something for him to take that will thicken the milk when it's in his tummy and stop him bringing it up so much. But have a look at, you know, the basics first. We always start base level basics. Look at your positioning attachment. Is your positioning and attachment as good as you can get it? Because if your baby's getting a lot more of that formula, therefore just taking more and more and more than they need, they're going to bring a bit up, and that's quite normal. Or is it just small amounts, in which case we're not so worried, because that's really quite normal for babies to be a bit sicky. It is the way things go. But if it's lots and lots at every time, then it might be worth talking to your GP to see how you get on. Okay, Ami's come back. She said, I've also been finding his feeding cues extremely difficult. Oh, just offer it to him and see if he wants it. And he will tell you if he doesn't. He's of that age, he'll be kicking off and going backwards because he's quite big now. He'll just tell you if he doesn't want it, but you can just offer. Most babies, if they do, they'll just take it. They'll just see it's a bonus that they're getting it. So, just Charlotte has said, I know it's for feeding. Any tips getting Alicia crawling, as I keep getting her to have her tummy time? Is there any other things I can do? Oh, you can't rush these things, Charlotte. I tell you now, this is because it's your first baby. You wait till it's your second, you'll be delighted they're stationary. You know exactly where they are. Nothing that you can do to encourage her to crawl. It will come. She'll do it in her own time. You know, babies are amazing, and some will bottom shuffle and others will crawl, but she will do it when she's ready, Charlotte. She'll get there, don't worry. But, and she'll be absolutely gorgeous. You'll take lots of pictures of her. Oh, I've already mentioned about Ruth. She said sorry, and there was no need to say sorry. Lydia Lishman said, hello, thank you for running these sessions. Have you any advice for managing a fast letdown? 3-week-old babies feeding really well and putting on weight, but fusses and cries a lot during and after. We just open up the rest. Which I think might be because the milk's coming through really quickly. Gulps, coughs, and has to stop a bit after the feed. Oh, poor love. It is quite tough when you've got a really strong letdown. Some mums just choose to take a little bit off. You know, just hand express that first tiny bit so they don't get that huge amount. Other things you can try is a more laid back feed, so they've got gravity on their side, as I mentioned earlier. So maybe feeding more in a laid back feeding position. So thinking about that means they've got gravity to support them, so the milk may not be going in their mouth so well. I'm going to say it again, I'll say it every time, make sure your positioning and attachment is as good as you can get it, because if a baby goes on really well, they can control the flow by clamping down gently, and they will be able to control it. But it isn't uncommon if you have a very strong letdown that babies can cough and choke a little bit. So your options are to, as essential, just maybe just take a little bit off, see if that helps. Obviously that's going to perpetuate your supply, but you can pop it to one side, donate it to the milk bank. Milk bank's always very grateful for any milk that mothers have. I'm not talking about taking loads off, I'm taking off that first little initial bit, maybe just hand express a tiny bit off. Trying a laid back position and making sure your positioning and attachment is as good as you can get it, Lydia, and see how you get on. I hope things improve in that respect too. Claire has come on. We know Claire from MVP. Hello, Alex. I'll be heading back to work. No, Fitz is 11 months old. My goodness. So, when he's 11 months. He's not 11 months yet. You're giving me the heebie-jeebies. Can't believe it's that long since I saw you. He'll be with a lovely childminder. Should I express, or can he have milk substitute for him during the day? Allergic to cow's milk protein and soy, so would Oatly be okay? Thanks, Claire. I would have to check that one, Claire. That's a very good point. Obviously, I mean, my first option would always be to say to you, if you can express, then obviously we would go with express, because we know for the most optimal health outcomes, having exclusive breast milk for the first 6 months and then alongside other foods is the best for any baby. Oatly I'll have to check, and for anybody else who wants to look these sort of things up, if you want to look up something to do with formulas or alternative milks, then the recommendation is to look at First Steps Nutrition. So first, as in number one, First Steps Nutrition. You can look it up online and it will have it up there. So the Helen Crawley, who has set it up, has done an amazing job. It is evidence-based, non-biased information about all formulas from all different brands and all milk alternatives, and whether they are suitable. Yeah, I can see almost 11 months. Suitable for babies and children. So it's a really, really good resource. I would go and look at that. So Claire, you can have a look at that, and anybody else who wants to go and have a look. It's a very useful site to look up anything to do with formulas and milk substitutes of any sort, and whether they're suitable for children. She also has got a lot of information on there about foods, complementary foods from the leading all the manufacturers as well. So it is a very, very good resource to tap into for anyone who wants to know anything to do with formulas, milk substitutes, and complementary foods. So it's called First Steps Nutrition. So maybe we can chat later, Claire, and we both had a look and see what it says, because I can't tell you off the top of my head on that one, I'm afraid. But I suspect, yeah, have a look and see. move. That was a very good question. I've never had that one before. Amy said thanks. So OMVP have put quite an answer up to Charlotte, saying her VC, the VC from OMVP is having similar issues with her potato baby who likes to sit like a potato. I love it. But that's fantastic. So, and yes, suggested seeing the health visitor like I have. That's a very good place to go. Oh, Carolina, we've had you before. Welcome back. My baby Jonathan is now 8.5 weeks. This time goes fast, doesn't it? Just. And we're feeding well until about a week ago, where he started to be a bit energetic at the breast, unlatching constantly. Try to change the... Oh, let me go back. Try to change. Let me just find your question again. I'm just scrolling down. This is where it would be easier if it was on my laptop. Oh, not going to be there. Charge, it doesn't seem to help. Sometimes I go from breast to the other for a good 10 minutes until he finally settles down and feeds for even an hour. Wow. Happening mainly in the evenings. I know he's grown significantly. And I'm using a nursing pillow. Can the pillow make him uncomfortable? He's getting bigger. I'm thinking to remove the pillow, but I'm concerned I won't be able to support him well, as I have sprained my wrist during the labour and it's very painful. I'm also worried about his floppy head and how I can support it without having to hold it. So, thinking about positions. So, I would probably ditch the pillow from the sounds of it, because babies get older, we need more room for them. So when we're thinking about supporting you, anyone who comes to clinic will know that I potter around and I put things under people's feet and I put wedges in behind their wrists. So it's finding a way of supporting your wrist, but maybe without that pillow, because it's probably too big now. So it's remembering that babies grow. So thinking about, I'm just move my chair back. Excuse the noise. So thinking about when you start with your baby, let's start with a little one. So when you start with your little baby, you've got them here, and what you don't then want to do is when they get bigger, is to keep them here. Because actually what you then need to do is bring them further round. So remembering that your baby always wants to be starting nose to nipple on this side, that they're going to come further round. So your baby might have been there when they were tiny, and now you're going to allow for them being bigger and coming right round you. Okay, that's the first thing. Also, as the baby grows, so this baby's got bigger, we don't want so much here, we want less. So what you might want to be doing is thinking about having something to support your feet, so maybe some books under your feet, and then getting, I actually suggest things like a towel or a cellular blanket, something that holds its shape. So roll it up and put it as a wedge between your wrist and your legs. So that works really well. It's what we tend to do in clinics. We'll often borrow a mother's blanket, or like this morning I borrowed someone's fleece, and we rolled it up really tight and we put it between the wrist and this lady's knees. So think about grabbing a nice stack of books, put them under your feet. We use yoga blocks in clinic. They're really good if you've got them to spare. So something nice, raise those legs up and fill the gap between your knees and your wrist to keep him in. So it might be that he's not getting as good an attachment. And if you think about a pillow, so if you think about, you've got a nice big pillow that when you had a tiny baby allowed you to bring your baby on like that. So remember, you're thinking about the angle of the dangle. Where does your breast point? The baby wants to come on at the angle that your breast points. It doesn't want to be here. If your pillow is too high, that's exactly what's going to happen. Your baby is going to be up here. So think about, get rid of the pillow, look where your breast points. Your baby's going to be down there. It may have been perfect when you had a tiny baby and that pillow fitted in here just nicely, but now you've got a much bigger baby, you haven't got the room. There isn't the room for that pillow and this baby. So, and it makes it much easier for going out and about if you can use something else rather than a pillow. You don't have to take a pillow with you. We've had mothers turn up at breastfeeding clinic with pillows, which is fair enough if that's what they need, but actually being able to just have a rolled up cellular blanket that you're using anyway in the cot, in the pram, that would be much easier. So something firm, like a towel or a cellular blanket, that we can roll it up and form as a wedge between your wrist and your legs will be probably better than using a pillow that is a set height. They're fabulous for newborns, but they're not great as your baby gets older. So I think start with that, see if it works, and think about have you got your baby far enough over? Think nose to nipple. So see how you get on with all of that. So I hope that didn't overload you with that, Araceli, because you've done such a great job to have got this far. So, well done. It's absolutely fantastic. Just keep going, and those few changes may make all the difference. Emmy said she didn't mind me mentioning her. That's good to know. I didn't think she would. Carrying on. Ellie has said, I'm having issues with positioning and attachment when breastfeeding my week-old baby. My nipples point downwards and I have to hold my breast up while trying to support him. We often come off and have to relatch many times. Okay, so it's quite normal for breasts to point downwards, but what you could do, I'm just going to see if I've got a muslin in here. So what you could do is just make yourself a little muslin that goes underneath, so like a little sausage with a muslin cloth, okay, and that you put it in under your breast, and your breast will hold it there because it just goes in under the crease. And what that will do, it'll stop a breast from being down there to a breast being here, okay, and then you don't have to hold. You might still want to hold, and then you can bring your baby on. And because what's happening is if you're having to hold your breast and then you let go, what will happen is your baby will be going, you've lifted your breast, you've brought your baby on, you let go, and the breast does this and the baby will come off. So that might be why you're struggling. So think about rolling up a muslin, popping it in underneath, right up in the junction of your breast to the chest, and that will lift your breast up and point your nipple up slightly and allow you to feed without having to manhandle your breast. See if that works. The other thing we do quite often is we get tubey grip. It doesn't have to be tubey grip, it could be any scarf or something like that. So for people who've got larger breasts, because if you can't see your nipple, you can't feed, you can't put your baby on. So it will allow you to do this. So what you do is you put it around your neck, under your breast, it's like a sling, and it lifts your breast up. So you can imagine it coming around. Let's do it with this. It's not big enough, obviously, but if you imagine, it would come in and under the breast and then up around the neck, and that will just bring the breast up a bit. It's like a breast sling, and we tend to use tubey grip in the hospital if we need to do it. So around the neck, under the breast, lifts the breast up a bit, and you could use that as well depending on whether you need to or not. I'd start with this, start with a rolled up muslin, bring it in right underneath the breast, into the crease where it meets the chest, and that will bring the breast up, firm the tissue a little bit, and hopefully you'll be able to see your nipple and then be able to bring your baby on. And then the breast's not going to move if you move your hand, but maybe that's what's been happening to you. So keep going, Ellie. And your baby's only a week old, so get lots and lots and lots of support from your community team, because you're still under the community midwives. You get community visits right up to day 10 and beyond if your baby hasn't made it to its birth weight. Make the most of these times. The health visitors are, they've got a lot on their plate at the moment. We work quite closely with the health visiting team, and we know that they've got a lot on too. So whilst you've got their midwives coming in, make the most of their visits, and tell them that you're struggling, get them to watch what you're doing. If things don't improve, get in touch with us, and we'll do what we can to help you. There's obviously, we always mention OBS, so Oxfordshire Breastfeeding Support, La Leche League and Abingdon Baby Cafe are all offering support. In fact, Abingdon Baby Cafe have now started doing a coffee morning on a Tuesday, virtual coffee morning on a Tuesday for anybody in that area, and hopefully that will go back to being a proper baby cafe in the future when we're allowed to do those things. How exciting. So Ellie, all the best, and keep going. I know it's tough, but you're 1 week in, it's going to get better and better. Claire's just said thanks. We'll share knowledge later, Thea and me. So let's just see what Amy has said. Amy said, I love these sessions. Oh, thank you. You and Naomi set me up with all the info and I needed ready for when my daughter arrived. Oh, brilliant. My little girl is now 6 weeks old, and I've been breastfeeding and expressing a couple of times a week over the weeks. The last couple of weeks I've been experiencing a sort of tight, like a stretching elastic band sensation in my boobs going from the nipple back. It's rather uncomfortable. I bet it is. This happens in the opposite boobs that she's feeding on, and when I'm not feeding, pain never happens in the boob at the same at the time being fed from. Is this normal? I think that sounds a bit like your letdown still, I'm afraid. Mentioned to my doctor, but she just asked about checking for lumps. And as that time is fine, she didn't comment on the pain. It sounds like letdowns, just the way you're talking about them. If it's happening in the other breast when you're feeding, it sounds like your letdowns. It's really weird. I was chatting to a mum in clinic this morning about some people feel them, some people don't. Some people feel that they're really painful, some people feel they're a tingle, some people feel really awful with them, and other people feel nothing. So they are so varied, but the timings that you're giving me make me think it's probably letdowns. So it's oxytocin from your pituitary gland right back here that's going down into the two breasts. The baby that's feeding on, probably you're noticing it less, but the breast that your baby's feeding on, you'll feel less. And possibly that's why you're feeling it on the other side, because it's the one thing breasts do together is let down. Other than that, you can have completely different supplies. You can shut down supply in one and keep it going in another if you need to, which some women do. Women who've had mastectomies can feed on one side. They can just get a good milk supply on that's the one side they've got. So it sounds to me like you're let down. You haven't mentioned it, but I'm assuming it's fairly short-lived. If it's fairly short-lived, it comes, it goes, and then you maybe get it once or twice during a feed, or even more, or in between times. It does sound like oxytocin to me. Have a look and see what other people have written about it, but it's very varied. It doesn't sound like anything I'm concerned about, though. It does sound quite normal. And to say, some people find it very painful. Some people find that it's just a tingle, and other people don't feel anything. It's very varied what people feel. So I think I'm going to reassure you and say, Amy, that it does sound quite normal, and see if it just carries on. Just pay attention to when it is, and maybe if you notice that your baby's just got going again sucking, and you feel it on the other side, they've had a pause and they started again, then that might be what's happening. And if you do, when you're doing your pumping, do you notice it when you're pumping, when you suddenly get a bit more milk? Can you see it coming into the pumping funnels? So it does sound like oxytocin, your letdown reflex to me. Laura's put, these sessions are so helpful. I find the answers to other questions help me learn so much. Thank you, Laura. We actually really enjoyed doing them. And it's nice to be able to answer these questions. And everyone I've met today have been watching them, which is really lovely. May I please ask your thoughts on colostrum harvesting? I'm coming from Berkshire to have my baby with you any day now, and I've been given so much differing info from Berk's midwives, which goes against your advice at the JR. I'm keen to know if you'd like me to, I'm sorry, I'm just struggling to read it because I've got the background. If you'd like me to be harvesting, please help me with any tips if you can get any out. Should be worrying about feeding until baby's here. Thank you very much. If you're having your baby here, Rosie, is there a particular reason you're having your baby here, or is it just because you've chosen the JR? Are you one of the ladies who's on the cusp? Because some of our ladies Henley way come here rather than going to Berks. So if it's just because it's the hospital, if you're coming because there's a problem, maybe there's concerns about you or your baby. If there's concerns about your baby, then we'd be saying yes, get hand expressing. We have a leaflet on our web page. So if you go onto the maternity, on the maternity website, so I'm thinking where it is. If you go onto the Oxford University Hospital's website, the OUH website, go to maternity, go to infant feeding, you'll find an infant feeding tab, and we have a leaflet about hand expressing on there, and it talks about why you might want to do it and why we might be suggesting it. If there are no concerns with your baby, you've got no concerns at all, and it's likely your baby's going to be born at term of a healthy weight, and we've got no worries about your baby, then there's no indication to do it, unless you just want to learn the skill, but you don't need to collect it then. If there's any concerns about your baby, if your baby is a bit small for its age, if the baby's likely to be premature, if you're a mummy who has diabetes, then those are the reasons that we'd be saying it would be well worth you having some expressed colostrum. So it's not obligatory, it's there as I mentioned earlier, an insurance policy, just in case. So hopefully that clarifies it, Rosie. So everything okay, you're fine, baby's fine, going to be born at term, going to be likely to be a really good weight, then we're not worried. anything out of the ordinary, it's well worth having a little bit of colostrum. And have a look at the leaflet. You'll see, I think it's called Expressing When You're Pregnant. It's something like that anyway. It's a very, very obvious leaflet on our website. You'll find it in the resources section. So we look forward to meeting you at some point, maybe Rosie. Charlotte's come back. Sorry to keep asking for tips, but it's a certain amount of milk formula Leisha needs every day at night. Keeps waking. Always check a nappy. Not particularly at her age. You're going to be following her and seeing what she wants. Responsive feeding, we always talk about responsive feeding, don't we? So following what she wants, Charlotte, just see what she's doing, and as long as she carries on pooing and weeing appropriate to her age, that's absolutely fine. And then obviously getting her weighed once in a while. I know it's not so easy these days. There aren't any clinics, and you have to rely on health visitors, but just being aware that she is growing and keeping going. There isn't a specific amount that she actually needs. So just follow her, let her tell you what she wants. You've grown this gorgeous baby and she's kept her going for all this time. It's amazing. Laura has said, a second one for me. I'm currently pumping to maintain supply, but I think my pump shields might be a bit too small for my nipple. I've been told how to know, but could you remind us, please? You don't want to be rubbing. That's the main thing. Right, I've got pump kit ready. I was ready for all eventualities today and what we were going to get asked. So if you think of that as a pump kit, what you don't want is the nipple to be rubbing on the sides. The nipple should move freely in and out of the funnel. So the areola, this bit here should be sitting on the areola, so like that. But the nipple should move in and out of the funnel without rubbing. That's what you're looking for. If you're rubbing at all, then it's too small. You need a bigger pump kit. And bearing in mind that we go on and on about how big a mouthful a baby needs, and when you hand express, you want your hands back. You can imagine that a pump, if you've got the pump right here, that's not going to do you any good. You want your pump kits out beyond the base of the nipple. You don't want it right up against the base. This is an Ardo kit, and this is 26 actually, although it looks bigger, I have to say. This one is an Amida kit, and this is a 30.5. The standard kit that Medela hand out is a 24, so much, much smaller than this, and we would normally recommend that you be going for something like a 30.5 or a 28. That seems to suit most women. 24s are quite small, so if you've got a 24, it might be well worth looking at a bigger pump kit and see. And it does make a big difference to how much milk you're getting, because it goes back to this whole business about when we taught you about hand expressing, you wanted your fingers back from the base of the nipple. If that pump kit is right on the base of the nipple, it's not going to do what we want it to do. Not going to be very good. So have a look and see how you're fitting that funnel, and see whether you need a bigger size or not. Maisie has said, hello, my daughter was born on the 13th of March and we're formula feeding, and she's taking between 60 and 90 per feed every 2.5, 3 hours. Is this okay? Sounds fabulous. Sounds great. You're going to follow her, Maisie, regardless of how you're feeding, whether breast or bottle. We always responsibly feed, so let her tell you when she's hungry, and you're obviously not keeping to a routine, which is lovely, because you said anywhere between 2.5 and 3 hours, and she will take varying volumes, which is absolutely fine. You're going to notice that as time goes on, the volumes that she's looking for are going to go up and up and up. So that's quite normal, because formula milk is a finite, so an amount of calories in an amount of liquid. So if you imagine, it would be, count the calories in this bottle is 50 mils, but if she needs more calories, you've got to give her more. The difference with breast milk is that breast milk changes what's in it in the same volume. So women that are breastfeeding don't continue to produce more and more and more milk. They plateau and stop, and most women will produce about 750 mils a day. But with formula milk, Maisie, the volume that she needs will continue to go up and up. Let her tell you. Watch her nappies. She needs to be having a couple of good poos a day and 6 heavy wet nappies, and as long as she's doing that, you know you're doing a fab job. So the volumes that she will want will go up over time, and hopefully she'll be weighed at some point. She's born on the 13th, so she's 12 days, isn't she? So so you've probably been signed off by the midwives, and hopefully we'll be seeing your your health visitor soon, if not already seen them. The next weight may only be the 6th, but just watch. You know, is she pooing and weeing appropriate to her age? You know, we want some nice yellow poos. They're going to be a bit like putty. They're a bit thicker than babies that are being breastfed. And 6 heavy wet nappies a day, and they're nice and clear. You know, as much colour as champagne, no more than that. And then you'll know that she's getting what she needs. So keep going. Sounds like you've done a great job. Amy's come back. Thank you, that's reassuring. Glad it's normal, as the doctor looked at me like I was crazy. No, not at all. Short periods, and when she starts, like you mentioned, yeah, it really sounds like it's your letdown. Okay, Amy, and I'm glad I've reassured you. Well, Carolina's come back. Thank you very much. I have a footrest for my guitar, which I can finally find useful. Brilliant. There you go. You're not playing your guitar then. So that would be a really good use. So I was just checking what time we're at now and how much time we've got left. That would be a really good use for your footrest. Put your foot or feet on your footrest, and then fill that gap with something that's firm, isn't going to move. Oh, a couple more coming in at the last minute, catching in at the last second. Claire has come on. She says, hi Alex, Florence is 6 months now and finally sleeping longer stretches at night. I'm feeding her twice on average. Will this change? From 8 feeds each night, oh my word, affect my supply. Should I pump, or will it just adjust naturally? I really want to carry on breastfeeding her. It should adjust naturally, and 8 feeds a night, you poor love, that's a lot. You deserve to have slightly longer at night with her not feeding. Your milk supply should adjust, even when milk supply takes a drop. If it takes a knock and it drops a bit, you can always get it back. If you've had it, you can get it back. When we can't make an impact is when you haven't had it in the beginning. If you laid those foundations down in the first 2 weeks, then you're going to have your milk supply for as long as you want. And even, I think we've mentioned on these before, you know, even if your milk supply goes down, maybe your baby's that bit older, let's say they're over a year, and they're not very well, and they've only been feeding twice a day. And I know of someone who came into hospital with their baby, was admitted to hospital, not very well with an infection, ended up on IV antibiotics. That baby didn't want anything else other than breast milk, and this mum had only been feeding twice a day up till then. And by the time that baby left the hospital about a week later, the mother had a full milk supply again, because all that baby would do was breastfeed. It would not have any of the solids that was offered because it's feeding too rubbish, just wanted to be breastfed. So from that point of view, your milk supply might drop, but you can always get it back. But I'm assuming it probably won't, because if she's not doing so many feeds in the night, she'll get what she wants at other times in the day. It's been tough. That sounds really tough, really hard. You must be shattered, and you deserve to have a bit longer asleep. But I think you will be fine, Claire. If it's well established, you're 6 months, I think you'll be fine. Keep going. That sounds great, and you deserve a medal. Rosie's come back. Thank you so much. I'm coming to the JR purely by choice, as I know how amazing you all are. Oh, thank you. No issues with me or baby, so I'll stop stressing about colostrum. Absolutely. I don't know if you'd be horrified if I arrived without any. We would not be horrified at all. You do not have to have it. If you end up having an induction, maybe do some then. That would be a good thing to do in the time if you have to end up having an induction. But if you come in labour and everything's going fine, you do not need to at all. Maybe just have a go. Have a look on the UNICEF Baby Friendly Initiative. That's UNICEF BFI. Have a look and just have a go at the practice of it. So you've done it before you've had your baby. Learning how to do it when you're tired, when you've just had a baby, is hard work. So knowing what you've got to do before you've had your baby, you don't have to collect anything, just know what you're doing will make a difference in your confidence levels once you've had your baby. But Rosie, all the best, and for all the right reasons, I hope we don't see you, because if we do see you, it's because you're having problems. So I hope that you come in and go out and we never meet you, and that you do brilliantly. Charlotte's come back. Thanks for all your help and tips. If I have any more babies, I will come to the JR. She's come to the Spires. Wonderful. Sorry, I ask silly questions, but I want to be a great mum for you. You're a fantastic mum, Charlotte. You're so lovely. And you're not silly questions, because I bet anybody else out there is asking the same ones, thinking the same ones. So someone needs to ask them. And as I said, Claire came back going, it's been tough. I'm sure that's been really tough. Thank you, that's great news. So her increased feeding in the day will sort out the balance. It will indeed, Claire. So I always think about babies needing a finite amount of milk, and we anticipate as mums breastfeeding, you're producing on average 750 mils a day. Some will produce more, some will produce less, but the majority of women will produce on average 750 mils. And if your baby is not taking it at one point of the day, they'll take it at other times, so don't worry. And that's that whole thing about responsive feeding. They're not going to feed 2 o'clock. They're going to feed as and when. They're going to have maybe cluster feeds in the evening. They might, sort of feed sporadically during the day. They might have a few feeds at night, maybe not 8, which is an awful lot. And in the end, when you look at it, you go, oh yeah, my baby's had a minimum of 8 feeds in 24 hours. And we call it frequent, not regular, and that's what we're always aiming at. Maisie's come back. Thank you so much. We're nearly back at birth weight. She was prem, so still catching up. Definitely have yellow poos and wet nappies. Brilliant. Well done, Maisie. That sounds really good. Well done. And tough because you had a prem baby as well. That's really hard. Ellie's come back. Thank you. I'm just using the scarf idea and it's working well. Brilliant. I'm so pleased. It's simple, but it works. It's like a breast sling. Well, unless anybody comes in at the last minute, I'm going to say goodbye and thank you all to all your wonderful questions. They've been absolutely brilliant, and I'm sure there were lots of people out there who've been watching thinking they were very glad. And Charlotte says about silly questions. No silly questions at all, because there's bound to be someone else out there watching thinking, I wish I would ask this, and someone else does it for them. So thank you very much. And I think we should be reunited next week. Should be Naomi and I with a double act. And have a good week. I'll see you next week. Bye.